Good evening, everyone. Today's topic is complications and sequelae of pulmonary tuberculosis. So, the first is the aspergilloma. First is the aspergilloma. As you can see in the diagram, this aspergilloma is usually developed when the aspergillus species, aspergillus is a fungus, aspergillus species colonize in the tuberculous cavity. As you can see, this is a tuberculous cavity. In a tuberculous cavity, you can see this is a mobile mass. This is a mobile mass, and you can see this black is the air. This black is the air. Air is seen surrounding a fungal ball in a pre-existing pulmonary cavity, and this mass gravitates to the dependent portion of the cavity. To the dependent portion of the cavity in the prone position. In the prone position, and this is known as monod sign of aspergilloma. This is known as monod sign of aspergilloma. Second complication is a bronchiectasis. Second complication is a bronchiectasis. So, what is bronchiectasis? It is irreversible. It is irreversible, abnormal dilatation of. It is irreversible, abnormal dilatation of the bronchial tree. In TB, basically leads to bronchitis, and as a sequelae of the bronchitis, bronchiectasis develop. Very important is post-infectious bronchiectasis. In post-infectious bronchiectasis, you can see a very important sign that is known as signet ring sign. That is known as signet ring sign. As you can see here, this black is a dilated bronchioles, and you can see this white is a vessel. It is basically a vessel next to the enlarged airway. Vessel next to the enlarged airway. You can see here. This is a vessel. This white is a vessel. This black is a bronchus.
Third complication is Rasmussen aneurysm. So, what is Rasmussen aneurysm? It is a uncommon complication of pulmonary tuberculosis, and it represents a pulmonary artery aneurysm adjacent or within a tuberculous cavity. So what is Rasmussen aneurysm? It is a pulmonary artery aneurysm adjacent or within a tuberculous cavity. As you can see in the image, in the area of the cavitation, this hole is the area of a cavitation. This is the area of a cavitation, and you can see this in the red color. You can see rounded bilobed rounded bilobed enhancing lesion arising from the branch of the pulmonary artery arising from the branch of a pulmonary artery, and it is known as Rasmussen aneurysm.